Hello, my name is Dr. Tracy Wilson, and I own Global Health Chiropractic, and I wanted to share with you our doctor's report, Eliminating All Doubt. Now, I want to share with you, this is one of the most important things you get to go through in our office. And, at this point in the game, you have had your day one. We have what we call our discovery day, and we are currently looking over your process and your prospects if we didn't process you because of some kind of an emergency. And we are actively seeking to make a care plan for you. And if you're seeing this now, we believe that chiropractic is for you. And over the next few minutes, this is some of the most important information you're going to hear. This is one of the longer videos. There's 3 videos in the set. And we want you to take this time to really dive in and do this. But without taking any more time, I want to help you understand what's the difference between a full spectrum chiropractor and a limited scope chiropractor. And let me just give a little bit of feed to that. A limited scope chiropractor is going to concern him or herself with how you feel, what symptoms you came in with, and that's all. It's not bad, it's just limited to how you feel. Then there's a full spectrum chiropractor, and the full spectrum chiropractor is not only going to concern him or herself with how you feel, but with your overall health and well-being, and also with your families. And that is what we do. We're a full spectrum office. We are a global health office, so that's why we're Global Health Chiropractic. We want to take an overall look at your health and wellness and see how chiropractic, ailment, or massage is going to work to improve it. So here we go. In the context of where we're coming from, we do care about symptoms. We do care about how you feel, and most of our patients end up feeling much better in the very early days of care. But at some point, when you go through this, you're going to understand that there's a correction that has to happen. There is relief care, and then there's correction care, and there's wellness, and we're going to explain what that means later. But overall, we want you to understand that we're here for the overall picture. But while we can do that, I want you to understand a little bit more about your body. So let's dive into a little bit of anatomy. Your spine is one of the most powerful things in your life. Your brain communicates down through the spinal cord out to your body, and in the spine there are these spinal nerve roots that come out at every level, allowing this communication. So if I'm talking to you now, and I were to cover my mouth, we're going to hear but a bunch of mumble. Meaning you're going to hear a mumble, you're going to hear something, but it's not going to be clear. And we're going to talk later, that's called a subluxation. But more importantly, I want you to understand with what subluxation interferes with. See, as you're looking at this spine on your screen, this magnificent structure that is built both for protection and for function, houses the most powerful system in your body. If I were to ask you what the most powerful system in your body is, you might have said heart, the heart. But the reality of it is it's your nervous system, because your nervous system is in control of that. And the way that there's a little bit of information about this is that embryologically, as the spine forms, the ectoderm wraps itself and begins to make this nervous system. It folds over, called the notochordal fold, and it begins to develop out. And off the spinal nerve roots, off the spinal cord, the spinal nerve roots form, and off the spinal nerve roots, the organs form, and those end up being receptors. So when we look upon this formation, there's this direct relationship in the way the nervous system is formed and the way it functions. And as you get this, there's these 2 branches that come off. One goes forward, one goes backward. The forward branch controls everything, such as our eyes, our ears, our nose, our throat, our tissues, our heart, our lungs, stomach, bowel, bladder. And we'll show you a little film of this later. And this is just a few things the way we operate. The posterior branch is the way we're designed, from the back of our heads, down our shoulders, necks, down our hands, mid-back, low back, down legs, out our feet. And this part helps us to feel and stay coordinated. It's touch, temperature, the way that we move, the way that we articulate around the world. And we all know about that part. We're familiar with it. And chiropractic gets put in this little pain box, which primarily is this back part. Like, we're for back pain, we're for arm pain, we're for leg pain. And not that it's bad just for that, but I don't want you to get stuck in this little box. You can't forget about this forward branch. If you ever heard of anybody that got help with allergies, sinus, asthma, or a baby with colic or digestive problems or even infertility, you've heard of these things and you thought, oh, that's really weird, and you didn't fully understand it. Well, now there's some science behind this, and so we're at a time now that we can really understand what's going on. So think about this. If you're hurting, that's only 6 to 10% of what your nervous system is designed to do, transmit pain. So there's up to anywhere from 94 to 90% of your nervous system that's doing something else. So if you have pressure on your nervous system that's actually causing pain, what's actually happening in the rest of your system? So it's not odd to us that when someone gets pain relief, they tend to get some other kind of benefit. They start to sleep better, feel better, things that they didn't know could get better, feel better. And so one of the things that we want to do is we want to catch this before it's just a symptom, right? And I get it. Symptoms happen and we do it. And how does all this happen, right? Like, let's be clear about that. That's what we call a subluxation. And that's when pressure hits the nervous system and it begins to alter that. That's that muffled message there. And this is this really gross picture of, what happens with direct nerve pressure, but there's this functional aspect of the spine that begins to lower the transmission from segment to segment. And when that happens, it begins to affect the overall body and the way this transmits out to all these systems. So as we were talking about, it's amazing how these things all have to be coordinated. And when we lose the coordination, we lose the function. And so it's the reason I show you this right off the bat. Most people come to us for pain, but it's never why they stay with us. They stay with us because they're functioning optimal better. They breathe better. Their sinuses better. Their digestion's better. All these magnificent things are happening. And so it's just invaluable for you to understand how powerful your nervous system is. Listen, our body doesn't need a lot of help. It just doesn't need interference. So one of the things that we searched for today in the office was we looked for this interference, and we did the scans, we did x-rays, possibly if you were of age or needed them, and we began to look at this process of where this interference is in your body. And so the reason we want to know about this, where this interference is, because if we just listen to symptoms, we're in trouble. So let me give you an example. If I'm driving down the road, my oil light comes on, and that means I need oil. Now, if I reached my glove box, took out a piece of tape, covered the light, and said, I don't want to see the light anymore, and just kept driving, is that smart? No, it's not smart at all. I mean, it doesn't take a rocket science to figure out that would really end up costing me more time, costing me more money, because if I just cover the light and don't fix the problem, then it's going to still be there. Well, if we stop and put oil in the car, that's actually fixed it. But if we just look at the symptom and say, oh, that's the old car, so that's why we're not just listening to your symptom. We're actually taking a measurement of the scans. Because the symptoms are good. They let us know something's going on, and we need to pay attention to it, right? I mean, if we're getting headaches or bronchial tubes don't work as well, or the baby's screaming because they're in colic, which means the colon's in spasm, we got to listen to it, but we can't just mask the symptom. We can't just put a piece of tape over it and hope it gets better. Worse yet, what if I walked over and I reached in the glove box and I pulled out a pair of pliers and I clipped the wire that goes to this light, and I said, hey, I don't want to see that anymore. Or I pull the fuse box and I said, I don't want to see the light anymore. It doesn't change the fact that my car needs oil. It doesn't change the fact that I need to pay attention to the cause of this light and not just the light. See, we've been trained to pay a lot of attention to the lights, but if we do that, it's going to cause a lot more problem. I mean, imagine this. Imagine if you're in a building, the fire alarm goes off, the fire department comes screaming into the parking lot, rips the switch off the wall, cuts the wires so the alarm goes off, and walks back out and never looks for the fire. We'd say, oh my gosh, you're an idiot. And so the reality of it is, this is how we've treated healthcare for a long time. So as we begin to understand this, I want you to understand a few things. By nature, the word allopathic means opposite suffering. It's not healthcare. It means if you have pain, well, you're going to get a painkiller. If you go in with inflammation, you're going to get an anti-inflammatory. If you go in with a muscle spasm, you're going to get a muscle relaxer. So it's easy to understand that medicine is designed to opposite your suffering. So when people ask, why do I have a spasm? Why did I get inflammation? That's the most important. We got to act like a 3-year-old here and keep asking why. And so we can look at it. I mean, a lot of people are saying, oh, you got inflammation because of this or that or whatever. And I get it. But one of the most beautiful questions that you've asked by sitting in this chair today, and you're listening to this because you asked the question, could this be pressure in my nervous system? So we're not just looking for a pill, potion, or lotion to put in my body and just cover it. We're actually looking at this before our health deteriorates while we're covering the symptoms. So we have to look at these warning signs. We have to take a look at it. We have to listen to them. But it's not how we're going to judge ourselves. And why would we do such a thing? Because here's what the stats show us. That in America, medical error based on, and what we're looking at medical error, is these are prescription drug problems, right? The third leading cause of preventable death. And as you go look at this is back in 2013, so it's even grown since then. In fact, we'll show you the next slide, how it is grown. And in another study here, America was compared to 50 other developed nations. They wanted to see where we rated in health status. Okay, this is health status. And America ranked 42nd out of 50 developed nations. Now, that's interesting because we consume 62% of the world's drugs, and we have more operations in a year than any other country. So if we're thinking about this, if we're consuming 62% of the world's drugs and we're performing more surgeries and we have the best technology in the world, wouldn't that mean we have better health status? And the answer is no. It doesn't mean that, because these things aren't health care, they're sick care. And we'll talk a bit about this in just a minute. So when we look at this multi-billion-dollar industry, we have to realize that there's not anything that they can do. I mean, if I walked into the medical office and I said, hey, make me healthy. It's time to make me healthy. What are they going to do? Give me a drug? Give me a surgery? No, I just want to be healthy. I want to feel better. I want to function better. Well, what are they going to do? Give me a drug? And if they do give me a drug, then there's these things called side effects, which, by the way, aren't side effects. They're just effects, right? I like the word side effects, but they're effects. There's a cause, the pill, and there's an effect. And it might be symptom management, but let's don't downplay the effect. They're just effects. Now, when you look at this, this is what this number means to us. So you look at the slide here. And the study said over 300,000 people were dying every year because of the medical industry. And these were for a lot of reasons, but they equated this to 2.5 jumbo jets every 2 days. And now let's think for a second. If 2.5 jumbo jets were crashing every 2 days, what would happen to the industry? It'd be shut down. And yet, not this industry. No one questioned it. No one really challenged the golden goose. And so we have to look at this and we have to understand exactly what we're doing. And we have to understand we're not looking at causes, we're looking at symptoms, and we try to do this, it's going to cause this. And look at what's happening now. We see this raises in opioid deaths, right? In fact, the studies are just overwhelming. If you look this up, which most of you have, you're seeing this addiction to these opioids just skyrocket. And you're seeing this in older populations. You can see this from 2013 when the study was done, and the numbers were already bad, but look at opioids, what's happening. And because the thing of it is, we keep managing things by symptom, and we're not asking what the cause is. And so I want you to get this. There's a difference in healthcare versus sick care. Most of us have understood the terminology, but we really haven't understood the thought. But if we're really taking this, if you take a healthy society, and I love this quote here, if you take a healthy society and you put it in a sick care system, you get a sick society. So there's a design place for medical doctors, and they're made for crisis, trauma, and emergency. They're brilliant. They're wonderful. They're unparalleled in this kind of care. I mean, if I'm in a car accident, I get my arm ripped off, don't take me to my chiropractor. Take me to a medical doctor. Let him sew the thing back on, do his brilliant work, and do what they're designed to do, and then get me to my chiropractor once I begin to heal so I can begin to optimize my nerve function so that healing and regulation begin to happen. I want to have optimal health after that, so once the crisis and trauma is done, I need something to do. So let's go back to the fire analogy. Can you imagine the fire department coming in? And so let's say they put out the fire. Let's say they actually put out the fire. They take their axes and their water and they spray and they put the fire out. Now there's this disaster, right? Now after this disaster, do I call the fire department to clean it up? No, I don't call if you call the fire department to clean up the mess that they caused, they're not going to do it. Just like if you call medicine, sometimes there's a need for these things. And in many cases, people have had multiple drugs and surgery for the problems they're in here for, and we're left to clean up the mess. And that's a bit of a challenge. Our goal is to catch it before any of that. Our goal is to catch it before, which is why we're a family wellness practice. We want to see mom, dad, and all the kids, and we want to see you on a regular basis so we can optimize your nerve function, and we can keep you from ever getting into the symptom management by drugs problem, and hopefully prevent all these things down the road. So that is the gist of what we want to share with you today. There are 2 more videos, and they're going to be going with the 3 causes of subluxation and the 3 kinds of care as we move forward. But I wanted you to get this understanding deep down in your recesses so that as we move forward, you can begin to understand what this is all about. So thanks for listening. Listen to the next video.